Okay, thanks Sabrina for hosting me, and I'm happy to be part of the 2020 PPHP Summit. And today, my talk is going to be discussing the importance of financial freedom for the health professional in the COVID-19 era. And if at any point we get mumbled or jumbled, just let me know through the text. And today is information is for educational purposes only. So I have no financial disclosures pertaining to this talk. What works for me may not work for you in your particular situation. So do your due diligence. But I'm going to give a quick overview of my talk. It's going to be a little bit of my background. I have a very unique and entrepreneurial background and a story. I think the need for financial literacy for all of us is really high and great. So I'm going to talk about that, and specifically the top mindsets and skill sets that I've developed over the last 20 years and how that's helped me to flourish, especially during events such as the financial crisis and events such as COVID-19. And I'll tell you how you can best prepare yourself for these types of situations. Then, I'll be open to live Q&A at the end of the talk. So a little bit about my background. I came up from very humble beginnings. I grew up from an early age. I was always the outsider. So I grew up with a lot of dysfunction in my family, a lot of uncertainty. I was bullied, discriminated against. So growing up, there was no way that I would succeed under a very rigid, white-collar, bureaucratic, corporate 9-to-5 environment. So all the odds were stacked against me and out of my control. And so I became very entrepreneurial because I had to develop that skill in order to survive. So one day I decided to myself three conclusions. One was I would never be dependent upon anyone or anything to be able for my future economic success. So I would not be dependent upon a job. I would not work for anybody. I would not work for a corporation for 50 years. I wouldn't depend on the government, Social Security, or pensions. So in order to accomplish that, I had to become an entrepreneur. I always taught myself to always have a plan B, C, and D in case anything ever happens. So currently my income sources, I have 8 to 9 sources of income. So, with COVID, it wiped out one income source, but I had another 8 to fall back on. So that really helped me to thrive and flourish during these times. And the key here is, as opposed to earned income, I always focused on creating passive streams of income. So that meant whether you worked or not, the income streams would come flowing in. So go ahead and, type in the chat box. How many of you grew up with the story, work hard, go to school, get good grades, get a good job? Go ahead and type that in the chat box. Yeah, I think so. I think a lot of us here, especially in the healthcare profession, we we always grew up with those messages. So I grew up on the cusp of Gen X and millennials. So back then, right at the cusp of the ending of the industrial age, the key to financial independence and freedom was to get a high-paying job. So I went into the high-paying professions because those were the ones that would provide future economic stability, but not necessarily because I was passionate about it. So nevertheless, in today's information age, it's a little bit different. So the paradigms are changing. But I went to Baylor for medical school, was part of the MD PhD program, went to Rice University, and during medical school, started investing in real estate and in stocks and in options. So by my final year of medical school, I was 29 years old. I was able to generate income without needing to go to work or working for anybody. But nevertheless, all of my deans and mentors told me that to strongly encourage to pursue the conventional route. That was the safe route, to always have a backup. So I matched into orthopedics in 2007 at Rutgers University, and to put it bluntly, I was extremely unhappy and unfulfilled in my career choice. So at the September 2008, I think, Sabrina already discussed it, but I took a leap of faith, walked into my chairman's office, resigned on the spot, and the rest is history. I never looked back. So from 2008 to 2016, invested in single family condominiums, and by my mid 30s, achieved a level of financial freedom and security such that I would never need to work for anybody or need a job if I didn't choose to. And so I'm trying to share that with you, not to brag, but to show you how powerful it is if you take a leap of faith. And I'm trying to inspire and motivate you. So if I've done all of those two, then I've done my job for tonight. I spent a year abroad, traveling throughout Europe and Southeast Asia. Came back to the States in 2017, launching my freelance consulting company. So now I give back. I'm a 4 times Amazon author. I've appeared on top physician influencer platforms, including Kevin MD. I'm a digital creator running my monthly boot camps, masterminds, workshops, live trainings, online programs, seminars, and I do a lot of private and group coaching. So my mission is to bring awareness about financial literacy into the healthcare professional setting. So right now we just finished a month-long boot camp, and 40% of my students from beginning, just never having had a consulting client, secured their first client. So I'm really happy with the results, and I'm continuing it further. So I'm going to move on to the next slide. So there is so much uncertainty living in today's times with globalization, with technological disruption, with the internet. So I want you guys to take a look at this chart of the Dow over the last 3 months. So in no time in history have we been living in such uncertain times in terms of our future, incomes, security, well-being. First COVID-19, then the riots, now borders being closed, tensions between US and China, and in particular, our profession is getting taken over by managed care. So I started to see that in 2002, and that's when I started to prepare, educate, and get myself ready. But with great uncertainty comes great opportunity. In our profession, what you're seeing is managed care is eroding our autonomy, independence, and authority, whether it's by insurance, with either through bureaucratic regulations, through lawyers. You're also seeing a lot of specialties getting taken over by private equity. So initially it was just anesthesia, but now it's other fields. So what that means is that our skill sets, knowledge, are being commoditized, making us easily replaceable. So what I want to point out is that there's a disconnect between executive management and the administrators and the healthcare workers. So in today's climate, there is no such thing as a sure bet, a job certainty. There's no such thing as that anymore. So in order to mitigate that, we have to create our own job certainty. So for example, at the peak of the COVID-19 crisis, hospitals were asking for volunteers, but they were laying off physicians. They were also not providing adequate PPE and punishing those that spoke up against the system. And at the same time, the higher-ups were working remotely and also had no impact to their income. So if this doesn't make you concerned, it should, because what that means is that all of our futures is at a greater expense. So now is the best time to be considering and building upon the ideas and knowledge so that you can start creating additional sources of income outside of your job. So you're going to see, so for example, I'm going to talk about top mindsets to have. So we as physicians in healthcare, we have a lot of mindsets that help us really succeed clinically. And it really boils down to being very effective when we take care of patients and when we save lives and we diagnose and treat conditions. So some of those skills are hardworking, intelligent, smart, caring, driven. We're very results-oriented, action-oriented. We have a lot of integrity, so which gives us a lot of a lot of trust and brand authority, right? So, but what happens is that there's a disconnect between upper level and healthcare workers. So what happens is that the upper management and executives mistake the caring and the genuine attributes of a physician, and they mistake that for weakness. So what we have to do is we have to take our top mindsets that make us thrive clinically, and we have to apply those to new endeavors and situations. That's the first thing. We also have to identify mindsets that help us clinically but hinder us in entrepreneurial realms. This is, for example, I'm working with a private coaching client, and she is in her early 30s, but she feels that she's missed the boat. I can assure you, she's way ahead of 99% of all the physicians out there. Another client, he's a dermatology. He's already board certified, but he feels that he's not qualified to do consulting. So these are the sort of things that we have to identify, and we have to learn how to minimize those types of limiting beliefs, mindsets, and we have to develop newer and more empowering ones. So that's what I do, especially in my group coaching, my private coaching, my masterminds, things like that. I feel that some of the top mindsets that help me thrive and succeed are contrarian thinking, especially being innovative, outside of the box thinking, being creative. And also, I feel that any sort of struggle or hardship, whether it's financial, career, relationship, health, if you can overcome that, you have a story to share and inspire people with your ideas. So here's some of the top skill sets, and it's the same thing. It's the same paradigm. So I go from mindset to skill set. So once I get the client's mind right, then we can start focusing on the particular skills that will progress and propel them towards success in their careers or relationships or health in all other areas of their life. So, and it's the same paradigm. So we're very problem solving, we're very solutions oriented, we're results oriented, and we're very analytical. So those sort of things help us, right? And a lot of these skill sets that will help you succeed as an entrepreneur, if you take these and apply them to the clinical realm as well as your outside business, you will flourish. And I've seen it time and time again in my clients. So especially as an entrepreneur, as investor, consulting, working with clients, things like that, it's all going to be relationship and people based. So a lot of it's going to be networking. So I talk as really networking is the number one key skill to have, whether you're as a physician or a consultant or not, because one of my mentors said that your net worth is equal to your network, because then you have resources and people, ideas, finances, connections to draw upon. The other thing is going to be all about communication. So relationship building is all about communication, interaction with people. It's going to be about being able to speak in front of people in public, and also be able to influence, persuade, and also it's going to be a lot of marketing and sales. So you have to get in front of people, you have to express your ideas, and you have to sell yourself, you have to sell your personality and your ideas. And you also have to develop your brand. In today's age, it's all about using technology and social media to leverage that. So how can you prepare yourself? It really it brings me back to 9/11 2001, because that was my turning point. I thought I was in medical school, and I thought my entire future was mapped out in front of me, but I started to see the effects of globalization. I started to see what managed care was doing, so I had to start preparing myself for things such as what's happening in our world today. So I just started to educate myself. A couple books that really shaped my life were Rich Dad Poor Dad, Creating Wealth, Multiple Streams of Income, and Getting Started in Options. If you read those 4 books, it's life changing. So, and those 4 books, are less than $50 on Amazon, and they can change your life. So that's how powerful those are. All it is an investment in your time, energy, just to read it and apply those principles. So really start to educate yourself. And I recommend it through a stepwise progression. So one is to expand your network and your mastermind. So, I host monthly masterminds, and a lot of networking. I also, books we talked about, digital programs as well. And also I host a lot of boot camps and workshops, but really start to educate yourself. There's a lot of free resources, podcasts, YouTube is great. And if you feel like I've inspired you and you want to, reach out to me, either I have my 4 books on Amazon, or you're interested in my boot camps, workshop, and my group coaching and masterminds, reach out to me. So with that, I'm happy for your time and attention. I thank you for it. Your time is very valuable. I'm happy to answer any questions, and this is my contact if you're interested in getting a hold of me. I'm on Instagram, Twitter, Pinterest. I'm also on YouTube, Facebook, and Amazon. So just type in my name and you can find me there. And I have my email address, ChristopherLu, MD, PhD @gmail.com. But thank you.